My name is Amy Gordon. I'm a physical therapist here at Evergreen Hospital. I have an interesting subspecialty within the field of physical therapy, so I'm the pelvic floor rehabilitation specialist. What that means is I've been trained as a physical therapist and then have additional special training in the pelvic floor. And so when I started way back when, over 20 years ago in sports medicine, I never thought I'd actually find myself as a pelvic floor specialist, but it's such a fascinating area and something that really makes a difference in quality of life, and I'm passionate about what I do. So with that, I'm going to go ahead and get started and hopefully have some things, even if you're not having any pelvic floor issues right now. I think that this is information that really applies to everyone, male and female. Yes, men have pelvic floors as well, and this is information that we really should all know and understand better. Some things I want to go over with you, I'm going to talk about just good bladder and bowel health. So I think a lot of times just basic information in terms of what is considered normal is not necessarily well known. So we'll talk about defining that first. I'm going to go into detail a little bit more on what Dr. Plaskon spoke about in terms of fluid and fiber intake and how to really establish healthy bowel habits and bladder habits, and then talk about pelvic floor training. So it is definitely more than just Kegels that we're talking about. We're talking about, thank you, strengthening the pelvic floor muscles, but also learning how to relax those pelvic floor muscles is equally important. Okay, so we're starting first with bladder health and what is considered normal. And sometimes this is surprising to people. The normal voiding, or number of times that you urinate during the day, is 5 to 8 times for every 2 to 3 hours, not more than 4, and not awakening more than once a night. So this is interesting. So usually people stop me at this point and say, well, that's fine, but ever since I was a child, I've had a small bladder, and I pee every hour. And in fact, everybody in my family has, all the women in my family have small bladders, and it's hereditary, and that's why I have this problem. And I'm here to tell you that there's very few people that necessarily have small bladders, but oftentimes what they do inherit, and particularly among women, but this also happens to men, is this habit of this just-in-case peeing. And for short, we call this jicking. And so if you're wondering what I'm talking about with this just-in-case peeing, just you can think about, I'll step away a little bit. You can think about how mothers often will say, oh, before you leave the house, let's everybody stop at the bathroom before we leave, just in case. Oh, you know, we don't know what kind of bathrooms we're going to find when we go out to that public place. Let's stop here just in case. And there are smart times to just in case pee. So I'm not going to tell you to never do this. I have young children, toddlers, so there are necessary times to just in case pee with toddlers. It's urinating before you exercise, urinating after intercourse, urinating right before you go to sleep. Those are great times to just in case pee if you're going to try and sit through a concert that's 2 to 3 hours. Of course, just in case pee. But if you've gotten into the habit that every time you leave the house or every time you pass a certain bathroom, you need to just in case pee, what you're doing is you're bypassing those normal brain reflexes that Dr. Plaskon talked about that stimulate that urge. And what that does over time, if you're regularly doing that, is it gives your body a sensation that your bladder is small. And so what's happening is you might have just a little bit of urine in your bladder, but you just in case peed. And then the brain gets confused and thinks, well, wait a minute, maybe it was full. Oh, okay. And then next time you might get that urge signal sooner. So in the following slide, I'm going to give you some strategies to use to kind of break that habit of that just in case peeing. But one way you can check and see, did I really need to go, or was this, you know, have I just been drinking tons of water? I see many of you with tall water bottles or also tall cups of coffee. Maybe you really did have to go. So one way that you can discern was that a just-in-case pee or a false alarm is counting how many seconds you void. It's not a perfect science, but it sure is a lot easier than measuring your urine output. And so what you're going to do is you're going to count 1 Mississippi, 2 Mississippi, 3 Mississippi. Count how many seconds of a steady stream you have. And a good rule of thumb is you want at least an 8-second pee. Again, not a perfect science, but it'll give you a good estimate that those bladders at least halfway full. So we're going to talk a little bit more in detail how you can establish that bladder retraining. Other things to consider, of course, leakage of urine and then not straining to empty your bladder. So you really shouldn't have to push or strain to start that urine stream. Voiding or urination is really more of an active relaxation, letting it flow. If you're having to work hard at that, then we probably need to look at how those muscles are functioning and how to train them to relax more rather than contract. Okay, so this is the basics of bladder retraining in a nutshell. So it may surprise you that an urge is not necessarily always a command to drop everything and go to the toilet right away. Some people, particularly if they've had recurrent urinary tract infections, get kind of nervous that if they just feel a little bit of urge in their bladder that they should be going right away or they'll get another infection. But you want to ask yourself, when was the last time I voided? You know, if it's only been a half hour, it's unlikely that your bladder is full again, but it may be that you're getting triggered one of those false alarms. These false alarms are a real sensation. So I'm not telling you that this is just in your head. You really feel at the level of your brain that you have to go. It's a real sense of urge. But this is one of those times where if you then go to the toilet and void and it's only a 4-second pee or 5-second pee, I would propose that you really didn't have to go. There really wasn't even enough urine in the bladder to necessitate that. So how you can break this is what I consider mind over bladder or mindfully voiding. And it really does work. I know this sounds kind of silly. It's kind of like potty training adults, but you give it about 10 to 14 days, and if you mindfully void and keep track of this, you'll really find that your actual bladder capacity and your control to delay the urge and get to the toilet on time can change dramatically. And I've seen a lot of people, again, we tend to, sometimes I think, like Dr. Plaskett said, we tend to blame this on MS and the neurogenic bladder, but sometimes it's a matter of just these habits we've established. And without changing anything else but these habits, we can make a huge difference in your functional ability to get to the toilet on time. So what would this look like? So if I had voided maybe just half an hour ago or 45 minutes ago, and I get a sudden strong urge, what I want to do is I want to stop and be still. And so actually sitting, if you have the opportunity, helps facilitate with pelvic floor relaxation. So again, if it's possible to actually sit down, some deep, calm breaths help. So your bladder system is tied to your fight and flight response. So the more anxious and tense you get, the more facilitation to that bladder, the more excitable it gets, the more likely you are to leak. So instead, this is that mind over bladder piece. You need to take nice, deep, calming breaths. You need to try and distract yourself. Distraction is powerful. I'm sure that all of you can think of a few examples in your life where you really, really had to go, but you were in a conversation or doing something else and were able to distract yourself, and sometimes that urge passes. So distraction is huge. You can use pelvic floor contractions, and we'll talk about that later for what those are specifically, but doing some gentle pelvic floor contraction can also help calm that bladder urge. And then sometimes, as necessary, you've got the Squatty Potty dance where you can actually squeeze the legs together or thighs together, and that can be helpful short-term to help calm that urge. So what happens if this urge persists? So let's say you go home today and you think, well, I'm going to try out what she was talking about. And you try the deep breathing, you try the distraction, you try sitting down, you try your Kegels, and you still feel like you have to go. So, of course, you should still go if you need to, but it's really important that you pause at least long enough to let that strong sense of urge pass. So if you drop everything and you rush to the bathroom, then you're just reinforcing that signal for next time. And the urge may even get louder and louder each time. So it's very important when you do decide to walk to the bathroom that it's a slow and controlled and not an urgent rush. The more that you race and rush and scurry to the bathroom, the more excitable that bladder gets. Another thing that's really important to consider in terms of this bladder retraining is your internal dialogue. So we're always having a conversation in our head. You're having a conversation in your head right now, just as I'm talking to you and you're listening. And if your conversation in your head as you're trying to get to the bathroom is, oh, I'm never going to make it. I'm gonna wet my pants. I don't know how to change of clothes. What am I going to do? I'm not going to make it. It's more likely to cause more anxiety and stress, and you're actually more likely to leak. If your conversation in your head is something like, I will not pee my pants, I will not pee my pants, the subconscious mind actually doesn't hear the not part of that statement. So this is an old, this is a psychology principle. I know in Weight Watchers classes they sometimes talk about this. This is relevant, really. So if you've been in a Weight Watchers class and they say, if you focus on I will not eat chocolate cake, and you think no chocolate cake, no chocolate cake, you know what your brain hears? Chocolate cake, chocolate cake, chocolate cake, chocolate cake, chocolate cake. Well, the same thing applies to your bladder. So if you're scurrying to the bathroom and your brain is hearing pee pants, pee pants, pee pants, what do you think is most likely to happen? You're more likely to pee your pants. So I want you to even come up with some sort of mantra, a positive statement, and that can be whatever you want. I mean, I have a sample up there in terms of I am in control, or I have strong muscles, or even just something as simple as this will be okay. So even if you do leak a little bit on the way to the bathroom, you have a plan in place. But if that anxiety builds and you have that statement like, pee my pants, the most likely thing to happen is that you might have an accident. So again, it's a very simple approach of mindfully responding to these urges and staying in control. And it will take about 10 to 14 days to establish these habits, but they really, really do work. They're quite effective. And the other thing, I just went back one slide I wanted to cover in terms of these triggers. There's a lot of these where it becomes a habit, and that habit becomes so ingrained that things become triggers. So the most common ones you might be familiar with is just the sound of running water, right? So many of us, well, hopefully all of us, wash our hands after we toilet. And so we begin to associate toileting with the sound of running water. This can work to your advantage when you're training a young child for potty training, right? It's moms that are turning the faucet on to try and get the child to train. But as adults, we can often have that training trigger. So the sound of running water can trigger that sudden urge even if we don't have to go. One of my favorite examples of this, my grandmother lived in this beautiful retirement community outside of Chicago, and at one point a donor donated this gorgeous fountain outside the entrance to the facility, and it's really a sweet story, but it is funny. So they had meeting after meeting where the residents were asking them to turn off the fountain because the location of the bathrooms from the entrance to this way was so far away that people would get an urge in response to the fountain, and then they couldn't walk the long distance to the public bathroom. So there was this whole thing about this wonderful donor and this beautiful fountain, and they wanted to turn it off because it was causing too many problems. But that's a great example of how a simple trigger like running water, and maybe over time people had responded so many times to that running water by going, and that urge had gotten stronger and stronger, such that they couldn't even walk by the sound of the fountain without getting that sudden urge, regardless of whether they had emptied their bladder just 10 minutes beforehand. So it's important to look at some of these triggers and identify them in your life and try to change the pattern. So if you always respond to the sound of running water, it might be washing your hands. Another common one I hear is washing dishes in the sink, so that running water. If you know that you really need to go, you should go. But if you know that you've used the bathroom recently and it's just because you're washing the dishes and you always go to the bathroom in between washing dishes, try out some of these urge delay strategies and see if you can override and avoid responding. Because the more times that you respond to those triggers, the stronger and more powerful they become over your life, and they can really become problematic. One of the other most common triggers is the key in the door phenomena. And there is an actual name for that, the key in the door. And that can become really challenging, and particularly if your mobility is becoming more challenging. So if you have to drop everything, and for those of you that don't know what I'm talking about, it's when you get your key in the door and you have to drop everything and race to the bathroom. But if your mobility and the speed in which you can move is slowing down, it might be harder and harder to enter the house. One of my favorite examples, this was when I was first starting this work quite some time ago now, that the patient came to me and she had the key in the door so severe that just driving up to her house and looking at the front door was enough to cause a sudden urge. And she said she she had a great sense of humor about it, but she said, this is ridiculous. I am literally trying to approach my house, the front door, not looking at it. And she had even found, and she had even found that if she didn't make eye contact with her front door and walked around to the back of the house, to the back door, she was okay. Oh my goodness. Right? So it's a great example of, this didn't happen in 1 week's time. It's happened decade after decade that she would walk in the house, drop everything, and make a beeline to the bathroom, and that door became more and more powerful a trigger. So I really encourage you to identify even some of these more subtle triggers in your life. And they may just be a small annoyance now, but over time, if you continue to respond to them with the urge, then they will become more powerful and they can become quite debilitating as well.
Mine is when the bathroom door is closed.
Yeah? Yeah, so a comment was that you're just seeing a bathroom door closed, or for some people it'll be seeing a line at a bathroom is enough to cause this sudden urge. So it's funny stuff, and we all experience it, right? But the more that we can start identifying this and just understanding why we're getting that sudden trigger, and it's like Pavlov's dog. So remember that psychology study a long time ago. So he rang the bell every time he fed the dogs. And then what he found was that just ringing the bell alone was enough for the dogs to salivate. So you need to identify whatever that bell is for you, whether it's a key in the door or a certain bathroom at work or a certain leaving the house every time, and see if you can separate the two so that you're not always responding in the same way. Okay, so bladder irritants are also a really relevant topic to this. And Dr. Plaston touched on that lightly, but I want to go into a little more detail. So as I'm looking around the room, most of you have your tea and coffee in front of you, and I think we all kind of recognize that coffee can be a bladder irritant. So the tissue that lines the inside of the bladder is very sensitive. You'll notice that all the things I have listed there are fairly high in acidity as well, so that those higher acid content tends to irritate the lining of the bladder and make it more reactive or overactive. So that being said, even decaf coffee, because of the acidity, can also be irritating. Cold brew coffee or low acid coffees, which are available, and even Trader Joe's has a few to choose from for those, can be helpful. But just keeping in mind that what you drink may be part of the problem as well. One strategy, I'm a coffee drinker, I'm not going to tell you to not touch coffee. Think about drinking a water chaser after your cup of coffee. So you're going to dilute some of that acidity by taking in some water afterwards that is less irritating to your bladder. Another one on this list that is really quite irritating and can be problematic is artificial sweeteners. So I keep an eye on that. And then carbonation. So even the sparkling water, the bubbles can be irritating. Probably the worst choice you could make would be a Diet Coke or a Diet Pepsi. So you've got the artificial sweetener, the caffeine, and the bubbles all together to irritate the bladder. So taking a look at those, and I'm not telling you to never have citrus or tomato-based products, by the way, they're really good for you. But when you wake up in the morning, you might not want to have a cup of black coffee, a glass of orange juice, and half a grapefruit, because that would really be setting you up for overactive type symptoms as the day goes on.
Question? Yep, tea. What about herbal teas? Is that the same thing?
Good question. So the question was, what about herbal tea? So I'm really getting at black tea here, so with caffeine, but non-herbal lemons, my favorite lemon zinger, would also be an issue because of the citrus, so the lemon or the orange you would want to avoid as well. A good alternative, green tea is relatively low in caffeine and is not particularly acidic, so that would be something to consider as an alternative. Getting enough fluid. So the general guideline is 6 to 8 cups, which is 48 to 64 ounces. But you look around the room, we're all different sizes and different levels of activity. So this is really just a rule of thumb. And if you're bigger or if you're exercising more or once the sun comes out and we're warmer again, you really do need to increase your fluid intake, and that's important. Not drinking enough fluid can also irritate the bladder. So I see plenty of patients that when they leave the house, they just try not to drink anything because they don't want to be bothered by having to get to the bathroom or urgency. And maybe decreasing your coffee or tea might be helpful, but you want to make sure that you're not reducing your intake so much that urine becomes more concentrated, so that darker yellow urine can then also irritate the bladder further because of that acidity. So keeping an eye to not restrict the fluid intake, because that strategy can actually backfire on you. Okay, so now we made it to the bowel health. So what's considered normal for bowel health? For regular bowel movement, about every 1 to 2 days. No straining, and I'm going to talk about why that's important. Feeling completely empty after a bowel movement. Soft form stool that passes easily, and then no leakage of stool or gas. Now, I'm sure that if you're leaking stool, that's gotten your attention, but I also want to mention that if you're leaking gas, so if you find that you can't hold back gas when you want to, that's a sign that there is some muscle weakness there, and that would be an indication for strengthening. So what can you do? You can start a bowel program. Surgeon General guidelines are to add 30 grams of fiber or more per day. I would caution you that if you're not having 30 grams of fiber right now, if you suddenly decided to do that today, you might be kind of surprised by the results. And the typical American diet is really nowhere near 30 grams of fiber. So you really need to increase that gradually, and there's great food sources to do so. Considering a stool softener can help, but I also think that just finding foods in your diet that have that higher fiber that can help you get there. Massaging the abdominals, and there's a technique you can even Google online, abdominal massage for bowel movements. The I love you just refers to a description. So in terms of the path of the bowels, the I comes across here, the L is here, and the U moves around. It's supposed to help you keep track of it. I just look it up. Anyhow, if any of you, when you had children, if you learned the abdominal massage for the little babies, it's the exact same technique for adults, but it can really help stimulate that motility to those contractions moving through. It's a very gentle massage. You're not pushing hard, but it would be something that you could do along with regularly sitting down on the toilet for 15 minutes and establishing that routine. Walking and exercise stimulate bowel regularity. So one of the best things you can do is just a walking program or gentle exercise. It doesn't have to be in the gym working out, but just taking a walk or getting on an exercise bike or something movement-wise. And then keep in mind that the bowels are creatures of habit. I tell my patients often they're creatures of habit and they're slow learners. So they are. So any changes that you make for a bowel program, it may take 2 weeks, even 4 weeks for your bowels to really respond. This is why I think everybody has had this experience when you travel, particularly if you travel to a different country, what usually happens? The bowels just slow down. It's an unfamiliar place, they get different food, maybe a different time zone, and just about the time that you start getting normal again is probably when you come back home, and then you need to start your habit all over again. So keep in mind that the changes are slow, and you have to try and keep the routine as much as possible. So this applies to even having breakfast at around the same time every morning. So having the breakfast, having kind of the same breakfast can even be helpful. Having a warm beverage. So there's the gastric colic reflex, which is where particularly warm drink, and it can be as simple as even just hot water, if you wanted to do hot water with a little lemon water can help stimulate the bowels. Our bowels are really tied to our rudimentary brain, and so they have a strong connection with our smell, our olfactory system. So even just the smell of your coffee brewing every morning can sometimes stimulate that urge. Coffee is a natural bowel stimulant, so sometimes that can be helpful in moderation. But having that same routine of the smell of the coffee or the smell of your cup of tea brewing, and then having your meal and then sitting down on the toilet at the same time every day can go a long ways to establishing that routine and that regularity. But I wasn't trying to discredit the guideline of 30 grams of fiber in your diet, but I think at the end of the day, the best thing you can do is look at your output. And so to normalize that stool consistency, we have this lovely chart. And yes, I have this chart laminated in my office, and I refer to it regularly. And what this chart is doing is just kind of, I know you can laugh, giving examples of what are common types of stool consistency. And your goal is type 3 or type 4. And the print is kind of small, so I will read it to you. So type 3 says like a sausage, but with cracks on its surface. Type 4 says like a sausage or a snake, smooth and soft. So if you're too far up on that chart, then, you know, and that's more kind of those rabbit pellets or firmer stool, then the first thing I do is ask you if you're drinking enough fluid. And then you might say, Amy, I can't drink any more water. And then we need to think about adding more fiber to your diet, or lastly, maybe even a stool softener. If you're more towards the bottom of the chart, that can also cause problems, because that means things are moving through too quickly, and you might not have time to get to the toilet on time with more of the diarrhea. And so this is where fiber is this tricky thing, and I'm hesitant to tell everyone they need 30 grams. Because if your stool is looser, one of the things we often do is tell you to eat more fiber. So fiber is sort of the solution for too high on the chart and too low on the chart. So at the end of the day, it's really important for you to look at your output. And that gives you the best information for that given day in terms of your fluid and fiber intake and bowel health. There is not one magic number for everyone in this room, but it's important to figure out what works for you to have that kind of ideal type 3 or type 4 consistency. Okay, so I need one of those stools. So Dr. Plaskon briefly talked about the Squatty Potty. I've been talking about the Squatty Potty for nearly 18 years, just for the record, but then it was on Shark Tank recently, and now it's gone mainstream. So Squatty Potty, it used to be a website, and I had to send people to this funny little website, and it was like $50 or $60. And now you can find the Squatty Potty at Costco even, Target, Bed Bath, Best and Beyond. There is nothing super special about the Squatty Potty, other than it's a stool that wraps around your toilet so that when you go to stand up, you don't trip over the stool. That's the brilliance of the Squatty Potty. And for that, we pay between $19.99 and $29.99. But it is a clever design. And why the squatting is useful is depicted on this little this cartoon here to the left. And so basically the last corner that the stool has to go around before it goes down the chute is called the anal rectal angle. And the more bent you are at the hip, the straighter that angle is. I'm going to say that one more time. The more bent you are, the straighter the chute is. It's kind of counterintuitive. Like in my head, I sort of feel like maybe the straighter I am, everything just goes straight down. But trust me on this, we've studied this a lot, and the more bent you are, the easier it is. So this is why cultures where they are squatting over the toilet, they don't have nearly the incidence of the bowel dysfunction, constipation, and hemorrhoids that the typical American does. However, if you have not been raised squatting over a toilet, now might not be the time to start. Because you need to be able to relax at the same time. So what you can do is purchase one of these lovely stools, or you can think about just putting a step stool under your feet. So it allows you to have a little bit more bend in the hips, but also relax at the same time. And so this is where you might want to even think about, and reading materials could come in handy. So leaning forward as well. I can't hear me as well when I do that. So if you lean forward and rest your elbows on your sides, you're also increasing or decreasing that angle and bending more at the hip. So it may be as simple as putting a footstool underneath or leaning forward, or both. I was so excited when I first moved into our new house because I was 6 months pregnant at the time, and it had those nice raised toilet seats. And I thought, oh, this is so nice. But I'm 5'5", 5'6". I'm not particularly small or tall, but I need a step stool in order to comfortably get at it at a good angle. And so those raised toilet seats can be great, but then you may also need to balance that out by adding a step stool underneath. And then I want you to think about how you use the muscles for a bowel movement. It's really important that you're not straining or pushing hard to have a bowel movement, even if it feels like it's difficult to initiate. The act of emptying your bowels or your bladder is really about relaxing the pelvic floor muscles. And so if you're pushing hard, sometimes what we find is people are actually contracting the muscles instead, and then they're trying to push through a closed hole, which is not an effective way to empty your bowels, as you might imagine. So as much as you can look at how you're breathing and using your abdominal muscles, so some of these sample sounds, and yes, there's 5 or 6 listed up there. I'm going to go ahead and show you what happens to my abdominal muscles when I do this. So if I place my hands on my belly, for those of you can see, and I go, or, can you see what, if you can't see from behind, what's happening with my hands on my belly is my belly is kind of widening or drawing out. And that drawing out contraction also helps with relaxation in the pelvic floor. An example of what you don't want to do is what my toddlers initially did when they were little, and that was something that sounded like this. And you could see like their eyeballs bulging and veins popping out of their face and stuff. So you can hear what I'm talking about too, so that's about salva. So that's the technical term for closing off your throat and pushing. It is a way to generate a lot of pressure, and it does get things moving, but it's too much pressure too fast. So instead, you do need to generate some sort of pressure to initiate that bowel movement, but you want to do it with one of these open throat sounds, so you're still allowing a little bit of air to come through your throat, and you're allowing for an abdominal contraction, but it's not that sudden. And so I don't know why there's all these different sounds, but I can tell you that I teach this. I talk about this every day at work. Isn't this amazing? And people will come back and they'll say, the grr works better than the shh. And I don't know why, but different people, the other one that I like that's not listed up here is from labor and delivery, and people will say moo, moo, and it really helps drop the sound. Now, I should go on record as saying nobody should be able to hear you as they walk by the house. Right? So these are not loud noises. I did it louder just for your sake and because I have no pride. But these are really quiet sounds, but the sounds are what, the vocalizations are what allow you to make sure that you're not holding your breath, and they allow you to drop into that lower belly. So again, try out a few different ones and see what works best for you. This stuff is funny. This isn't specific to MS. This is specific to being human. Nobody talks about the proper way to poop, right? And this is really good information that really we should all know, but particularly if you're taking medications that lead to constipation or you're having difficulty with muscle coordination and muscle relaxation, it becomes even more important to look at this. The other detail that I don't have on the slide, but I do want to mention, is this concept of relaxing both ends of the tube. So what I mean by that is focusing on your mouth muscles and your jaw position when you're on the toilet and trying to empty. And this is really important. There's a relationship between your jaw muscles and the mouth. So the more that you grit your teeth and hold your mouth tight, the harder it is actually to relax the pelvic floor. And this just goes to the actual location of muscle control at the level of the brain. So if you're tensing your mouth or kind of bracing yourself for this bowel movement, you're going to have a harder time relaxing that pelvic floor. So take a moment and check and make sure that your jaw position and your tongue is relaxed as well, and that can be quite helpful. And then avoid bearing down. So that was my example of my toddlers, so that kind of type motion or bearing down. Instead, you want to think about contracting that pelvic floor, which I'll show you how to do in a moment, and lower abdominals prior to those increases in pressure. So one of my favorite phrases is squeeze before you sneeze. So thinking about contracting those muscles sort of in preparation for that increase in pressure with the sneeze. But this also applies to coughing, and applies to lifting, squatting, and kind of pushing, and then exhale with exertion. So just as I don't want you to close off your throat when you're pushing, if you exhale when you push and strain, it'll reduce some of that downward pressure onto the pelvic floor, and it'll make it less effort on the pelvic floor, but also less likely to leak if that's a problem for you. Okay, so we made it to the pelvic floor. And here's a lovely slide from two different angles of what's happening with the pelvic floor. The pelvic floor is not just one muscle, and it isn't just located in women. Men have pelvic floors as well. The pelvic floor muscles as a group have fantastic names like bulbospongiosis and iliococcygeus, and none of that you need to really keep track of, but I just like saying them because they're really great words. What I want you to picture is if we kind of simplify things and think about the muscles making a figure eight around your opening. So on a woman on both women and men, it's making a figure eight around that urethra, so the exit of the urine, and then also making that second figure eight around the anus. And so when we talk about doing a proper pelvic floor contraction and closing your openings, having that visual in your mind is really important. The reason why we call it a floor is because it forms sort of a hammock or a sling for those pelvic organs. So if you look at image on the right-hand side, that's looking at you from the side view. The pelvic floor muscles run from the tailbone in the back forward to the pubic bone in the front. And so that's that sling or hammock support that's just holding everything up, hopefully. All right, so the functions of the pelvic floor, we often call these the 4 S's. Sexual appreciation, sphincters, which is a fancy word for closing of openings, for bowel and bladder control. Support for the pelvic organs, like we just talked about in terms of that floor function. And then they're also a stabilizing muscle for the pelvis and the spine. And so I'll get into more detail, but I really feel strongly that the pelvic floor shouldn't be considered this whole separate entity, but it's really one of your core muscles. It's the deepest, it's the core of the core. But all this talk about pelvic floor strengthening and contraction, I think we sometimes also lose focus on the importance of being able to relax the pelvic floor. So we don't just want, I don't want you to walk out of here and think, oh, I just need to do Kegels and need to strengthen, because it's really important to be able to relax your pelvic floor. What happens if you can't relax your pelvic floor? You can't empty your bladder or your bowels. So the strength is only useful if you can also relax. And so one thing we do focus on in physical therapy is other means of teaching you how to relax. And so one of the tools we have is biofeedback training. I don't have a slide on this, but if you can kind of picture a very, very low-tech video game for your pelvic floor. So there's actual electrodes that we can place just outside the anal opening. The electrodes are similar to EKG electrodes that you have. And then we hook you up to a computer program, and there's actual exercise programs that are using your pelvic floor contractions to create a wave on the screen and then watch it go down. And so what this allows you to do is see what a contraction looks like, figure out what strategy actually activates the right muscles, but it also teaches you how to relax. Pelvic floor is a tricky area, right? Because if I tell you to strengthen your biceps, and you can look at your arm and watch it go up and down, and you go, okay, yeah, I'm relaxed now. Yeah, I'm contracted. Pelvic floor, we don't see a whole lot happening, right? So sometimes using these other technologies in terms of biofeedback training can be really instrumental to help people figure out what to do in terms of both contracting and relaxing. And sometimes it's actually necessary to work with a pelvic floor therapist like myself to actually have manual therapy to those muscles to teach them to relax. So just as your neck and shoulders might get so tight that you actually forget how to relax them, and you need a massage to teach the body, oh, yeah, right, that's relaxed. Okay, I remember. Sometimes direct manual therapy, whether that's vaginally on a woman or rectally on a man, is necessary to really retrain that pelvic floor relaxation. Okay, but for right now, I am going to focus on how to contract, so basic contraction. To simplify things, if you think of that figure 8 again, I want you to focus on closing your openings. And that's like you're trying to hold back urine and hold back gas at the same time. You're not going to try and focus on just the front or the back or work these muscles in isolation, because they really function all together as a group. Now, a big thing is to make sure that you relax your inner thighs and your buttocks. So this is one of my favorite stories. Dr. Oz, as you may know, is a cardiologist that he addresses all kinds of topics on his show. And this was a while back. One of my patients said, oh, you've got to watch Dr. Oz. The rerun's on tonight, and he just read a letter from a woman that was leaking urine when she was running, and so he taught her how to do Kegels. And I thought, oh, I should see what Dr. Oz has to say about Kegels. So I did. I watched the rerun, and I have to tell you that Dr. Oz had a perfect description, just very similar to what I have here. And he also said, and the great thing about doing Kegels is you can do them anywhere and nobody will notice that you're doing them. Then Dr. Oz proceeded to do this. And for those of you in the front row, you'll be able to see what I'm doing. He sat there and he went, oh. Even from the back, you can probably see I'm levitating right now. So what muscles am I using? My glutes, right? My buttocks. So I'm afraid there's probably many a woman and maybe men out there that were then suddenly fitting into their jeans better because they've been strengthening their glutes, but they were still leaking with the running. So that's probably the most common compensation we see is people just squeezing their butt cheeks. So if you're levitating or clenching your butt cheeks, you may be working your pelvic floor, but you may just be working your glutes. The other compensation is a little bit more subtle, but also something that you could spot quite easily. and that would be drawing your legs in. So if you're using your groin muscles and you're sitting or lying down, you'll see your legs roll inward a little bit. So they go like this. Or if you're laying down and you see your feet go, then that's your inner thigh muscles or hip rotators. And again, a common compensation, but in terms of starting to figure out the control of these muscles, we want you to figure out how to initially work them in isolation. And then last but not least, it's important not to hold your breath. So I see people that have true muscle weakness and they need to do strengthening, and they say, oh, well, I've been doing Kegels. Yeah, I did them for 6 months. It didn't work. Okay, why don't you show me what you do? And they go, okay, so it's not very functional if you can only contract your pelvic floor while inhaling and holding your breath, because then when you release that, you're probably going to lose it. So it is really important to watch that breathing pattern. The next slide I have is a sample exercise program, and again, this is for true strengthening. So if the issue is more the non-relaxing pelvic floor or true pelvic pain, this would be inappropriate. But if it's just a true strength muscle weakness, then this is a good approach. So you'll notice that I have both quick contractions and endurance contractions listed here. So just like any other muscles in our body, we have our fast twitch fibers and our slow twitch fibers. Our fast twitch are our little sprinters, and those are really important for a cough or a sneeze to get that quick contraction on the pelvic floor. But the pelvic floor is primarily endurance fibers. So 70 to 80% of those fibers are endurance fibers. So this is another thing I hear is people say, oh, I've been doing Kegels. I did them for 3 months. They didn't work. Oh, okay, what have you been doing? Well, I do 100 on-off contractions a day. But wow, you're spending a lot of time doing Kegels, number one. But number two, if you're only doing these quick on-off contractions, you're really not training for the endurance component of the muscles. And that's what's going to help you if you need to be able to delay a little bit longer, or you need to be able to hold it to get all the way to the bathroom. And so having both these quick contractions and endurance as a part of your home program can be really helpful. And then the guideline there on the quick contractions would be to practice contracting on the exhale and relaxing on the inhale. And that's simply to get you out of the habit of just holding your breath and sucking in. Okay, and then you can do a self-check. So there's a few different ways that you can tell whether you're hitting the right muscles and targeting this. So you can pull out a mirror and just see if you can contract those muscles. So on a woman, you could be looking at the vaginal opening to see if you can see closure at the vaginal opening. On a male, you can even just look at the anal opening and see when you contract, do you see a pucker there at the anus? You can use the stop-go test. Now, I do want to caution people, there is information on the internet that suggests that you should practice pelvic floor contractions by interrupting the urine stream, and this is a no-no. So if you end up practicing your Kegels or pelvic floor contractions by stopping the flow of urine over and over again, it can throw off the normal patterns in the brain, and then later on you find that you can't relax enough to empty. So it can lead to problems like urinary retention. However, if you wanted to use the stop-go test today and see just how you're doing, and again, in 2 to 4 weeks, I think it's a fine functional test to do. You just don't want to use that as a training time. We've spent years and years as adults training ourselves to relax our pelvic floor muscles in response to sitting on the toilet, and we don't want to do anything to untrain that response. That's an important training. And then internally, you can check internally as well. So on a woman, you could insert 1 or 2 fingers into the vagina and actually feel. Can you feel a contraction? This is a tough muscle area because you can't see it, but sometimes just being able to feel the contraction can be quite helpful. For men, it's more of just like you're trying to lift your scrotum up. So I can't exactly relate, but I'm told it's similar if you picture the image of walking into cold water and that lift that naturally occurs, that can be akin to kind of contracting those muscles. And then exercise, so as I mentioned, especially for women, it can be easier to contract the muscles if there's something in the vagina to feel with the contraction. So if this is an option for you, you could consider that as a training program. Blood flow is really important to this area, and so when it comes to sexual arousal, that increased blood flow to the muscles can be quite therapeutic. So that's another training option that is available. Okay, so now we get to the core strength. So I mentioned earlier that the pelvic floor is really just one of your deep core muscles. And so I want to challenge you to think of your core muscle system or stability system as more than just your lower abdominals. There's a lot of personal trainers and exercise physiologists and stuff that are talking about core strengthening now, and I think it's great that we're getting that recognition of core strengthening, but I think a lot of people, when they hear the word core, they just think of their lower abs. The lower abs are meant to work with the pelvic floor, but it's really much more of a dynamic system. So I like to think of it more in terms of a canister. So the top of that core is your diaphragm, which is a very large muscle under the rib cage. The bottom of that canister is your pelvic floor. The front is the lower abdominals, and the back is the deep spine stabilizers. So it's really a 3D picture. So there's a top, a bottom, and a front and a back. And if any one of those components is not working well, then you can have pelvic floor dysfunction, and you can also have other things like spine pain and related issues to core muscle weakness. And so all of these muscles need to be working together as a group in order to have a stable system. This slide just has a few other exercises that can be useful for strengthening the floor. There's a doctor some time ago that actually looked at almost 100 different exercises that physical therapists and Pilates instructors and exercise trainers thought were helpful for core strengthening. And then he actually used a system to actually measure the pelvic floor activity and figure out which ones kind of had the biggest bang for your buck in terms of the pelvic floor activation. So I'm not saying that all of this would be more for strengthening, but a few of these exercises are just good ones for general core strength that would also promote pelvic floor strengthening. So of his 100 exercises that he tested, within that top 10 list, some that you might be familiar with and might be useful for you are the bridge. So that's the one picture here with the little baby on the mom's belly. Just squats, so just a basic chair squat, also utilizing the pelvic floor. The picture on the top right is what we call the clamshell, where you're working your hip strengtheners, but also activates the pelvic floor really nicely. The picture with the ball is showing a modified plank. I'd probably do it without the ball to start, but that's another one that's useful. And then cat-cow from yoga. So if you're familiar with yoga at all, that's one where you're on your hands and knees and you round your back and then you arch. And if you use that with the breathing, that surprisingly enough works your lower abdominals, but also has really good activation of the pelvic floor. And I like that one because it also incorporates the breathing. So just some ideas to think about and exercises that you might even be doing already that you could just also focus on pelvic floor at the same time. Okay, so here's information in terms of how to find us. If you have any questions or feel like you need more information from a pelvic floor physical therapy standpoint, and it's just regular insurance coverage, so people usually ask, well, is my insurance going to cover this? And so whatever your regular physical therapy coverage will cover the type of pelvic floor rehab that we do. There's our information there. Thank you.